Welcome to Covered Season 2. Get ready for an amazing set of interviews with business strategists, insurance experts, and wellness professionals in Montana, Idaho, and Wyoming. The focus this season is to help growing companies build a healthy and safe work environment. We'll cover pressing questions like what exactly does it cost for a new business to provide health insurance to a team? If you're ready to take ownership of your business and your benefits knowledge, this is the season for you.
Just like that, Mark Eichler, we are here at the Co-op HQ, the giant conference room, sitting an appropriate distance apart, interviewing you today about value-based insurance design. For our listeners who are wondering, what exactly does value-based insurance design mean? Can you help them quickly understand what that's all about?
Yeah, I'll try to do my best here in the brief time that we have.
Sure.
But value-based insurance design is a premise that certainly for members on the exchange who have high deductibles, so they're insured, but they perhaps aren't covered because the deductibles are so high. So we want to be able to provide a benefit for them, value-based insurance design, using that premise so that we take certain low-value services and then increased cost share to members for those, and in turn being able to provide, in this case we're focusing on medications, so we have a large list of medications now for 2021 that will be no cost share, free to the member prior to deductible. So that's the premise of the value-based insurance design. You have to look at low-value services and adjust those in order to provide high-value services. In this case, we've focused on medications, like I mentioned, that will be no cost share or essentially free to members prior to deductible, because remember, a lot of our members have $5,000, $6,000 deductibles they have to meet before they might get any coverage of medication. So we've flipped that, so to speak, so that our members now can have access to certain medications at no cost share before deductible.
It seems to me like one of the problems that value-based insurance design is solving is there's a lot of people who have health insurance through Mountain Health Co-op, or anybody that might think to themselves, well, I have this insurance, but I'm hesitant to use it because, as you mentioned, this deductible. Is that one of the problems that value-based insurance design is positioned to solve, is getting people to actually use the insurance that they're paying for?
Absolutely so, and especially for folks like diabetics, people with cardiovascular disease, people with asthma or COPD, people with depression. We put a number of medications in those categories, so we want people to use those because using medications is not a bad thing. That's a good thing. It lowers healthcare costs across the board generally. People are more adherent to their medications because they can afford them. And in this case, there's no cost share to them. This is an exciting plan for us, especially for diabetics, because we now will be able to offer Tier 1 and Tier 2 insulins at no cost share to members. So imagine that, a free insulin essentially to members, because we've put this value-based insurance design together for 2021.
Now, is this unique to Mountain Health Co-op? Is this something that you're spearheading? And if I'm a member of the co-op, when will I hear about this? Should I already know about this? Should I be calling and seeing how I qualify for this?
Yeah, that's a great question. We will be marketing that and engaging a membership, as well as our agents and brokers that will be helping members enroll at open enrollment, certainly, October, November this coming year. Mm-hmm. So we're going to make this much more widely known and what the advantages are. We do not know if our other insurance carriers in our 3-state region will be offering something similar. We probably think not yet. Value-based insurance design is the premise has been around for a long time. I engaged the services of a gentleman by the name of Mark Eichler at the University of Michigan's Value-Based Insurance Design Center.
Wow.
And he's been the champion of this effort for well over a decade, probably maybe even 15 years ago. So I've known of Dr. Fendrick for a long time. So he helped us design that. There's a lot of evidence and design features behind all that have been developed in several other plans that have tested the waters for this. And matter of fact, CMS now has in their proposed rule making has encouraged exchange plans and like co-ops to build in value-based insurance design into their benefit plans. And so we just happened to jump on it right away. It's been in the works for us for about a year. We started last summer and just kind of worked through the process, and now we've filed our plans with CMS to incorporate value-based insurance design for our 2021 exchange products.
Wow. Can you walk through what it looks like today for somebody that might require insulin versus what it looks like in 2021 with value-based insurance design when it comes to how much someone's paying out of pocket? And I know those numbers can vary a little bit, but if I'm a member right now with this pain point that every time I go to the pharmacist to pick up my medication, or I'm shelling out money every time, how does my life change with value-based insurance design?
That's a great point and a good starting example question to ask. So if I'm a diabetic, for example, and I'm it's a new benefit year, I start up in January, and I have new sets of deductibles and out-of-pockets, et cetera. Well, for an insulin product, for example, let's just call it a retail price of $300.
Okay.
So if I show up at the pharmacy and I haven't met my deductible yet,
which could be thousands of dollars.
Yeah, I mean, I could be on one of our, depending on which metal level, bronze, silver, or gold you are, your deductible might, let's just say $5,000-$6,000. Well, until I've met that deductible, either through some kind of medical cost or a pharmacy cost, then everything is 100% to me. Now, we do have some cost share plans that members, it gets a little confusing because some of the products have more cost sharing right up front. But if you're just in a typical high deductible plan, I'm going to have to pay that $300 out of my pocket.
Right then and there.
Until my deductible and out-of-pocket numbers are met, and then I'm going to get some relief out of that. But until that happens, and depending on where my situation in life is, and especially due to COVID, I perhaps might have lost my employer-based coverage. Now I'm on the exchange because that's the only coverage I could find or afford. But now we'll be able to, in 2021, provide relief to that very same person. So if I'm a diabetic on that plan, now I can have my insulin covered at no cost share to me prior to the deductible, and that's the key point.
That's
prior
amazing.
To deductible.
Boy, you mentioned relief. What a relief! That's amazing.
Yeah, and it expands even bigger than just for diabetics, because some of the oral anti-hyperglycemics for diabetes, as well as the insulin, but the cardiovascular medications, to treat hypertension, to treat myocardial infarction, to treat arrhythmias, atrial fibrillation, peripheral artery disease, those are also included at no cost share. Some of the asthma, COPD medications are also going to be included in that no-cost share list, VBID list, we call it, Value-Based Insurance Design List, and then as well as some medications for depression in there as well.
I'm sure that's tremendous news for members thinking, man, my deductible, I meet that in the first couple months of the year usually, so they might have that to hold on to and potentially keep in pocket.
Absolutely. We've offered a similar product to our large group employers in 2020 for qualified high deductible plans. So they've been able to take advantage of that if they so chose that option for their employees. But now we can offer that on the exchange.
Yeah. And when you say exchange, so if I'm with another insurance company, I'm listening to this and I'm thinking, this sounds really great. I'm thinking of switching in November. how would somebody go about doing that the same way they always have in the past? And can you help someone walk through kind of the switching insurance process?
Absolutely. I'm not the total expert there, but
Yeah.
they can do everything that they normally did. They can, at open enrollment, they can work with an agent if they did that in the past. They can go to healthcare.gov. In Idaho, they can go to Your Health Idaho and get that information. In Wyoming, they would use the healthcare.gov just like they would in Montana. So they really wouldn't do anything different. They would just start looking at other insurance options for them, and obviously the co-op would be one of those options that they could choose to use in 2021.
Sure. Is there any question that I didn't ask about value-based design that you're thinking you should really ask this, Kyle? It's a good thing people need to know about.
Well, I think the main thing is to start paying attention to that, because it's difficult, for example, in a glossy brochure, or if they go online, for example, at healthcare.gov, it's difficult to show value-based insurance design in what they see when they go online to do that.
Yeah.
They're going to see a premium, of course. That's what they're.
Yeah.
But they're not going to necessarily see the benefits of that value-based design that we've embedded in that. So we'd like our members